Assalamualaikum, ladies and gentlemen. For your information, our forum will start shortly so please kindly mute your microphone throughout the program. If you have any burning questions to the speaker, you may leave your question in the palette link given in the chat box later. And also, please fill in the Google form at the end of the program given, as we will take note of your attendance and e-certificates. Hello, Doctor. Where are you right now, Doctor? Me, it is usually that way. Like when we put it as our backdrop, it looks like it's inverted, but other people see it as normal.
Oh, okay. Thanks, Ain.
Hello, Dr. Sharlini. How are you doing?
Hi, good evening. Can you hear me clearly?
Yes, loud and clear, Doctor.
Okay, perfect. Thank you.
Assalamualaikum and a very good evening to new participants who just recently joined our Google Meet for this evening. I would like to kindly remind you guys before our event, I would like to remind you to mute your microphone throughout the program. And if you have any burning questions to the speaker, you may leave your questions in the Padlet link given in the chat box later. Thank you. Bismillahirrahmanirrahim. Assalamualaikum and a very good evening to all the participants out there and respective doctors. Welcome and thank you all for coming to HealX's first career talk this year, in which we will be talking about next destination pharmaceutical doctor. My name is Solehah and I will be your moderator for today. Let us start our program today with some gratitude towards the Almighty so that our event will always be in God's blessing. Without further ado, I would like to invite Adam Ali as our Doa reciter for us tonight.
Assalamualaikum warahmatullahi wabarakatuh. InsyaAllah we may start with Kitab Al-Fatihah. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Arrahmanirrahim. Maliki yaumiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Bismillahirrahmanirrahim. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi wa sahbihi ajma'in. Ya Allah, Engkaulah yang mempunyai segala kepujian, Engkaulah yang berhak menerima segala kepujian, Engkaulah yang berhak menerima segala kesyukuran. Engkaulah yang memiliki segala pemerintahan, di tangan Engkau segala kebajikan, kepada Engkaulah kembalinya segala urusan. Allahumma ya Karim ya Rahim, cucurilah rahmat dan limpahkanlah barakah daripadamu ke atas majlis yang berlangsung pada malam ini. Berkatilah ia dari awal hingga akhirnya. Ya fa'alu lima yurid, kami juga memohon perlindungan daripadamu dari segala perkara yang boleh mencacat celakan majlis pada malam ini dan dari segala perkara yang boleh melalaikan kami dari mentaati perintahmu, dan kepadamu jugalah kami serahkan kembali segala urusan. Rabbana alaika tawakkalna wa ilaika anabna wa ilaikal masir. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Sallallahu ala sayyidina Muhammad wa ala alihi wa sahbihi wasallam. Alhamdulillahi rabbil alamin.
Amin ya Rabbal Alamin. Thank you, Adam, for the Doa recitation just now. Next, I would like to invite our director, Alicia, to give her speech. The floor is yours, Alicia.
Thank you. So, good evening to everyone present here. Thank you for spending your precious time today to attend this program entitled Next Destination Pharmaceutical Doctor. So, I am Elisa Natashyia, the program director of today's program. I would like to take this opportunity to welcome all of us present today to this program, especially our special guest speakers, Dr. Sharlini and Dr. Natashyia. So, ladies and gentlemen, what do we know about pharmaceutical doctors and their journey? Most of us, including medical students, know that there's more alternative path than being a clinical doctor. Now, what's clinical doctor then? Clinical doctors are doctors that are generally known to work in hospitals or clinic. We have always known that there are many alternative paths, but we don't know how. So here's the opportunity for us to know how and what it takes to become a pharmaceutical doctor. So I personally myself am very interested to work in a pharmaceutical company one day. So I look forward for this event, and I hope other participants and guests present today will have fun too. I hope everyone gain knowledge and have fun during the event. Lastly, I want to thank Pfizer for contributing in this program and sending their best representative as our guest speakers tonight. I hope everyone is having fun and relaxed. Thank you, and that's all from me.
Thank you, Alicia, for the good speech. So, before we go further, let's get to know more about our special guest, shall we? Here with us today is Dr. Sharlini Surendran, a country medical doctor from Pfizer, Malaysia. She has 9 years of progressive experience in medical affairs, governance, operations, and pharmacovigilance. Before joining Pfizer, she was attached to other pharmaceutical companies in a medical affairs capacity. She graduated from Malacca Manipal Medical College and had gained more than 7 years of clinical experience at the Kuala Lumpur General Hospital. And next, we have Dr. Natashyia Vejayarajah, who is a medical affairs manager and graduated from Bachelor's of Medicine, Bachelor's of Surgery in 2017. She then ventured into the pharmaceutical industry, starting as a medical liaison and later progressing to a medical affairs manager at MNC before settled down as a medical affairs manager at Pfizer. In our forum tonight, we will have two sessions. The next session will be that Dr. Sharlini and Dr. Natasha here will share their experience as a pharmaceutical doctor, and after that will be a Q&A session in which the audiences are more than welcome to ask any questions relating to our topic tonight. So if you have any questions, you can put it in the chat box down below too. And after this, I will give the floor to Dr. Shalini and Dr. Natasha.
Okay. Thanks, Nur Ain. So I'm guessing I'm going first, right? So, yep. So I'm going to share my screen. So do let me know when you can actually see my screen, yeah?
Okay.
Can you see my screen? Oh, you can, right? Okay, perfect. Okay, so sorry, I'm still very new to Google Meets. Normally we use either Teams or WebEx. So if any technical difficulties, I apologize now itself. So okay, just give me a sec. Okay, so very good evening, everyone. I know it's a Saturday, so I'm going to take you through a little bit about my journey. I understand that it's a Saturday night. You probably want to have coffee with your friends, so share your Saturday night with me. So probably get a cup of coffee, and so this is very very casual. I'll just share with you my experiences, and if you have any questions, you can ask me anytime. So so as you can see, career talk next destination pharmaceutical doctor sounds very interesting, right? So let me before share a little bit about that. Let me move to my next screen. Okay, so before I start, I would just like everybody to, I know the chat box is there, so just give me your opinions of what is the role of medical affairs in the pharmaceutical industry. What do you know? There's no right, there's no wrong. I just want to gauge your understanding of what a medical person in the pharmaceutical industry does. Okay, so just put in anything. So I'll just give you like a minute or two. It'll be very interesting to understand. And yeah, so let me just check what we have so far. Give medical advice, right? Just
Sorry,
anyone.
can I give my opinion?
Sure.
I think the role of medical affairs in the pharmaceutical industry, maybe they are involved with the trials of some new drugs. So they want to know the adverse drug effects and also the contract indications to certain drugs before it is released.
Okay. So that's part of it. So just everybody just give me your opinion. So as we go along and I share, it'll be interesting to see where we go with this. Do research, give medical advice. What you said also is right. Anyone else? So this is very casual, very sharing. There's no right, there's no wrong. So just put in anything. Okay. So I'm guessing okay, no one else. Okay, never mind. We'll just continue then. Just give me a second. Okay. So I'm going to take you through a little bit about my journey. So thank you, Nain, for your kind introduction earlier. I'll just take you through a little bit about my journey. So my background, in terms of education, so I have an MBBS from Malacca Manipal Medical College. I won't tell you when I graduated, so you won't guess my age. So after, so a little bit about why I got into medicine, because I do have a lot of relatives who are doctors, and it really interests me. Like, okay, this sounds very interesting. This is something I'm very passionate about, and this is something that I definitely want to get into. So then it started with my housemanship. So I started my housemanship in Hospital Kuala Lumpur. So, as you know, it's one of the biggest hospitals in Malaysia. So I did my housemanship for 2 years, followed by my MO-ship for 5 years. So I did a rotation in all departments, and I subsequently ended up in ophthalmology. And towards going, in between, I was actually doing my master's at that time. But more and more as I got into it, microsurgery wasn't something that I wasn't very passionate about. But patients are also something that I'm also very, very passionate about. So I was wondering what else I can do to actually help. So I actually managed to speak to a friend who was in the pharmaceutical industry at that time and got to understand a little bit more about it and how this can actually help patients. So that's when I got into the corporate experience. So I started off as a medical affairs manager in MNC, a multinational company, or a pharmaceutical company as well. So when I started off, I was a medical affairs manager. So what I did there basically was, as you start, you tend to actually give talks to healthcare professionals, educate them on our products, respond to any medical information. So if doctors have any questions about our drugs, then we respond to that. And then in terms of promotional material review, I'm sure you all would have seen some materials which talks to you about the efficacy of a drug, the safety of the drug. So that is also part of what medical does to ensure the review is accurate. We do not mislead. The safety aspects is highlighted. So that is one of the key roles of medical as well. And then from there, I got promoted to be a senior medical affairs manager. So the responsibilities, of course, get higher. And therefore, I had line management. So I had a team of medical affairs managers reporting to me. So my main responsibilities apart from the medical affairs role was to actually coach and lead a team of medical affairs. So after that, so see, I have a very long history, so just bear with me. Yeah, I went into FMCG, fast moving consumer goods, focusing on nutrition. So it's a little different from pharma, where I was the head of medical. So in this particular company, they actually looked into nutritional products, particularly infant formula. So here, role of medical is very important because, as you know, breastfeeding is the key thing for infants. But for those who can't, it's important to supplement with uh, infant formula. So it's very important to keep updated on the latest trends of nutrition. Because this is something which is important for infants and also safety for them. Because from a medical perspective, ensuring safety of our products is very important. After that, I decided that I wanted to come back into the pharmaceutical industry. So I joined an MNC as the Associate Country Medical Director, where I was looking over 3 therapy areas. So usually in pharma, they divide them into different therapy areas, depending on which pharma you join and which therapy areas they are focused on. So here, I was actually leading 3 therapy areas, and my main role was to ensure medical strategy. So whatever that we planned for the year is executed correctly. So here, leading a team of highly performing medical affairs professionals was my key role. So far, everybody so good. Any questions so far? Sorry, because I can't actually see the chat box when I'm presenting.
They say so far so good, doctor.
Okay, good, perfect. Okay, so let me see. Sorry, I'll just move on. Okay, so just now I asked you all what do we do in medical affairs. So I said this is very casual. So this is just one technical slide. So I'll just go into it a little bit. Sorry. One is to enhance patient access to and best use of optimal medical treatment. So here it's very important to clearly demonstrate the value to healthcare professionals of our products and also to payers such as the Ministry of Health throughout the life cycle of each product. So when I say life cycle is at the beginning, when it goes through the phases of research towards the after it gets marketing authorization. When I say marketing authorization means it's approved to be used in the country. So we have to make sure that that we emphasize on the value of these products for our patients and to enable them to have access. So to embrace patient-centric healthcare is also very important. So this is by engaging and partnering with a broader range of healthcare stakeholders to more fully understand the different roles of patients. So basically what this means is you need to map out, help the pharma in the pharma company basically map out the journey of the patient. So a patient, say with disease X, comes here, where would the patient be seen first? What is the journey of the patient before the patient receives the treatment? How can we as medical advise them on where we can actually bring in the medication earlier to actually help access to the patient? We also facilitate coordination and integration of different medical data. So like previously you said, involved in clinical trials. That's just one small part of it. Once the trial is out, it's also important to cascade the data. And when we cascade the data, we need to ensure that the data is cascaded in the correct manner, fully transparent in terms of the efficacy and the safety. So this is the only technical slide I have, just to give you an overview of what we do. And in a nutshell, basically it is, if you can see, medical affairs encompasses a lot. So we are the medical and scientific liaison. So we are the face of science for the pharmaceutical company. We don't sell products, we just carry the science. We educate healthcare professionals, so medical education. We provide medical information. For example, if a doctor takes product X and he wants to find out whether it can be used for this particular patient, so we actually assist with that as well. Medical communication, we work very closely with our partners, our internal partners, to have clear medical communication out to the community. And of course, very importantly, is also medical research, because without medical research, actually we wouldn't have any products available for our patients. Okay, so this is just like a brief overview. So now I move on to the next part, which is challenges. What are your advantages and disadvantages of working in a pharma? Okay, so each challenge actually should be viewed as something positive. Wherever you are, any challenge, always think of it as something positive and something to challenge yourself to learn. So when I joined pharma, to be very honest, I had a culture shock, because all I knew, and I guess all we always knew in medical school, is we know the disease, these are the treatment options, the diagnosis, so on and so forth. So all I knew was, this is your patient, you examine the patient, you diagnose, and you treat. So when I went into the pharma company, I realized I didn't know a lot of things. I was actually very sheltered in terms of my knowledge. So you work with different functions. So you work with marketing teams. So marketing teams are the ones that market the products to a healthcare professional, the sales team that sells. Then you work with other teams such as corporate affairs, public policy, regulatory, market access. So when I heard all these terms at that time, I was lost. But this is actually a very good challenge, because the positive is, over time, you learn and you expand your horizons. So it opens avenues to learn more, maybe even consider roles in other departments. So the sky is the limit. So it doesn't mean that if you join medical affairs, that is where you're only going to be. There's a lot of avenues that you can go into. Maybe medical affairs per se might not be of interest. You just want to go into research and development, there's an option. If you are very keen in terms of product registration, there's regulatory. If you're very keen to work with the healthcare professionals, you're keen to market products, you can go into marketing. So there is no limitation in terms of that. So, but as I said earlier, this was the main challenge that I faced. Is it hard working in a pharmaceutical company? Anywhere, it's always difficult, because you have different stakeholders. You have stakeholders internally and you have stakeholders externally as well. It is fast paced. Not going to sugarcoat. So everything happens very fast. As you know, the healthcare environment changes very rapidly. So it's very fast paced, but the ultimate benefit that you get from it is irreplaceable, where you help your patients. You're bringing medication to your patients early, and that satisfaction is actually very, very, it's amazing. Okay. So I would just put that as that. And then, the last thing I'm just going to address before I pass over to Natasha, and before we can have our open forum, is common questions that I get. Okay. So let me share with you the common questions. I've written down some here. So, so why did I choose pharma? I think I told you that before. Even though I loved clinical practice, I was always wondering what else is that I can do to make a difference. So the next question is, why not the insurance agency? They need medical people there, clinical research organizations, or even medical writing. So everybody is unique. Everybody has different skill sets. Everybody has different passions. For me, I found the pharma industry the most interesting, and this best suits what I was looking for. So I get to understand and be updated in the latest management because we have a lot of disease areas. We go deep dive into the disease. We go deep dive into the treatment options that are available. So you are exposed to vast amount of literature, and then you also get updated. You attend conferences. You get to know what's the latest, and also interacting with healthcare professionals from different backgrounds. So you get to meet doctors in the rural centers. You get to meet head of departments. You have different conversations, and you learn a lot. So this was what I was passionate about. So hence, this is why I got into the pharma. So the next question is, what if I suddenly decide that I want to return to clinical practice? So there's nothing that stops you. You can always return to clinical practice. Like for me, I have my license, so I renew it on an annual basis. So if I decide that I ever want to go back to clinical practice, there's always an option to go back. So another question is there any limitation? What if I would like to further my studies? So this is something that can be explored, and there are always options to do your master's in public health. You can also do your master's in business administration. So this, again, the sky's the limit. So again, it depends on what you're passionate about and what you're looking for. Is there any career growth? Okay, so this is another question that I tend to get. So medical affairs is one function. So you start off, if you were to look into the current situation, because I got into pharma some time back. So now it's actually very challenging in terms of roles that are available. So normally, right out of medical school, the option that you have is to join as a medical scientific liaison. Then you move on to medical affairs manager, and then you can become a medical director. Or if you are not passionate in terms of strategy and line management, managing a team, you always have an option to be a therapy area specialist. So you will be the go-to person regarding each therapy area. And then that it doesn't stop there. There are regional roles. That means region, you cover a particular continent, for example, and there are even global roles. If also you're not keen to be in the medical affairs function, you always have the option to move into other departments, like I mentioned earlier. Just to give you an example, some general managers are actually practicing doctors. I mean, who were practicing doctors before, but they found their passion towards managing a corporate organization. So the next question I tend to get is, would I recommend joining pharma? So like I mentioned, again, it depends on your passion. Everybody's different. Everybody has different goals. So it is a wonderful place to work. I have learned a lot. I've gained a lot of experience. So again, you probably can put in any questions you have specific that I can answer. So I think that is basically the common questions that I get. I don't want to overwhelm you all with too many things. So I'm the old person here, so probably very boring. So I hand over to Natasha, who's very young and energetic, who can take you through her experience in joining pharma. So over to you, Natasha.
Thank you. Thank you so much, Shalini. So I'm also not very familiar with Google Meet, so just give me a moment, yeah.
It's okay, doctor. Take your time.
All right. Okay. Could I just check if you're able to view my screen?
Yes, we can, doctor.
All right. Okay. Thank you so much. Thank you so much, Dr. Shalini, for your presentation. Thank you so much to the host and organizer of this event. And thank you again for having me speak here today. Good evening, everyone. Thank you to all of you as well for taking the time to join us today. So before I start, I'd just like to introduce myself. So I'm Natasha, and I'm currently working at Pfizer. So I think Dr. Shalini covered pretty much everything about what you may need to know about medical affairs in the pharma industry. And thank you, Dr. Shalini, because I'm still learning. I still consider myself a baby in pharma. I'm still quite new to this world, so I too learned in this session today. So I'm going to present a little bit more on my personal experience and my thought processes and what I did, a little bit more focused on my journey. So without further ado, allow me to begin. So thank you so much, Ain, for your introduction earlier. Yes, I graduated my MBBS in 2017 from IMU. And then I went to do my housemanship in Klang Hospital. So I'm not sure if you're aware, it's Klang Hospital. It's one of they have the biggest volume of patients, of course, next to HKL. And while I was studying for medicine, I have to admit that growing up, I was exposed to doctors, and I think I wasn't very sure myself of what exactly I wanted to do, but it was interesting. Medicine sounded interesting, and it sounded like something that I may want to, I could see myself in. So while I did medicine, I did enjoy studying medicine. I did enjoy the science, learning about diseases and therapy and all of those things. But I wasn't sure about practicing medicine, and I could only know once I tried. So I went on to do my housemanship. And while I was doing my housemanship, I realized that it wasn't for me. Some may say it wasn't my calling. So I actually don't have my APC license, and I left my housemanship. But before I did that, I wanted to look into what other industries were out there that I could use my degree and what little experience I had to use. So before I get into that, this is just a few examples of what's available out there if you were to have a medical degree. So what we all know about is to be a clinical doctor, but there are so many other things out there. So I first started with creating a LinkedIn account, and this was because, to be honest, at that time, I wasn't very much aware of what else was available for someone like me. So I used this platform, and I started connecting with others who had a similar background, but were in different fields of work at the moment. And as I did that, this was when I discovered the pharmaceutical industry. And from there, I discovered this department known as medical affairs. When I read through the job descriptions, because I started in the executive level, I started as a medical science license. And when I read the job description, I was very much interested in it, mainly because it had a lot to do with the science and also interacting with people. So I started off as a medical science license in a smaller MNC, and then progressed to be a medical affairs manager in an MNC as well, and currently in this position. So when I first got into this role, what stood out for me in the job description was, as I mentioned, the science behind it and communicating, interacting with people. But what I soon got to realize as I worked was I also enjoyed, I would phrase it as the project management work under this role. Sorry. Okay. So challenges. What were some of my challenges? So coming from KKM, this was a totally new environment for me. I was used to a certain system in the government sector, and here I had to relearn something new. It was pretty scary, to be honest. And I also came from zero experience. I have no corporate experience prior to this, and I had a fear that I may not fit into the role well. But I was very lucky because I was able to slowly overcome this, as I had a very good team and a very good manager who guided and supported me throughout my journey here. Another challenge I would say that I still till date sometimes face is confidence. Like I mentioned, right? I tend to say that I'm the baby in pharma. I still feel new to pharma. There's still so many things I need to learn. But I can also say that these challenges can be overcome because I've grown by learning from experience and never saying no to first times. And eventually, I could slowly feel myself gaining the confidence and wanting to perform better. In terms of advantages and disadvantages, I can say that some of the advantages of the medical role is that you become the master of science behind a therapy area or a certain drug that you're working with, and you interact with all level healthcare professionals on this science. A lot of the things I'm saying now, I'm sure is overlapping with what Dr. Sharlini had presented. So please bear with me. And it has also made me more skilled in critical decision making. And one thing I really found advantageous in the corporate world was that your voice is always heard. So if you have different ideas or you have things to share, you can always voice it out and it will be taken into account. Also, I like the work-life balance I have in the corporate world. The timing is flexible besides the core working hours, of course, and I get to work on my time. Most weekends are relatively free, but just the idea of being able to work on my time is something that is of an important value to me. And ultimately, the most important factor about these roles is the amount of contribution I would still get to make in the well-being of patients. So if you want to take a look at disadvantages, I would not really call this a disadvantage because every job out there will be stressful in its own way. It's just that it would be different. So what you face in the corporate sector would be different from what you would have to face in clinical practice. But if you enjoy what you do, that is what matters most. So would you choose pharma? I still get many of my friends who have been practicing and who might want to venture out ask me this question, like, what would you think of if you want to switch your career? The first thing I'd like to say is nothing is certain. If you are practicing as a doctor now and you wish to try something different, you can leave your sector, try something different. And even if after you've tried something different, you may not be happy or you want to return to practicing medicine, that option is available for you. Of course, you need to have your license. And like what Sharlini had mentioned earlier as well, you are not in just, this is actually another advantage about working in such a role, is that you are not only in your department. You can have the opportunities to venture into other departments, like marketing, for instance, if you're interested, and you're not limited. So a few questions I think you may want to ask yourself is, of course, where your passion lies. And can you see yourself working in such an environment? Are you willing to travel? What kind of a work-life balance are you looking into? Sorry. And of course, look into the job description. Do some research first before you were to venture into any other field. See if it matches your interests, because this plays an important role in how you perform in your new job or whether or not you like it. So that's actually all that I have to present for today. Definitely open to receive any questions at all. Like what Sharlini and everyone has mentioned as well, this is a casual session, so please feel free to ask me any questions. Thank you.
All right, thank you, Dr. Natashyia and Dr. Sharlini, for a really fruitful sharing session. Of course, everything lies on your passion about your medical roles, maybe the passion of maybe going into pharmacy or maybe doing a business in the medical society. And also, even though maybe some people think that Sorry. Can you hear me?
Yes, we can.
Okay, sorry. I got a really bad internet connection these days. Even though many people may seem that being for
I think we lost the connection.
Sorry, Doctor. Okay, she's back.
All right.
hello. All right.
Yes.
Okay. Sorry, doctors. Uh, anyways, I think it is about time for us to move into our second session, which is the Q&A session, and the audiences can give their questions that are related to the forum to the speech. So if you have any question at the moment, you are free to unmute your mic and also tell us which speakers you want to ask and then state the question. But also, if you are too shy to talk, you can also write your questions in the chat box below. And please take this opportunity because you will lose the chance to grab the knowledge from the experts from the pharmaceutical world. Okay, so we have a question. I think is it okay if we can take turns to for each doctors to answer this question? I have a question for both of the doctors. Does being a pharmaceutical doctor well paid? I think we can start with Dr. Sharlini first and then Dr. Natasha.
I knew that question would definitely come. So it would be nice to know what definition of well paid is. I would say it's competitive. It's not like you earn in like a different currency or what. No, it's competitive to the market. So I would say it's adequate basically, and it is in line with what doctors currently earn like in the government sector as well. So a lot of people think that it's like you get paid like in what five six so six figure salaries yeah, and you travel everywhere by business class or first class. No, actually that is not the reality. So just so that,
Of
Natasha,
course.
do you want to add on to that? But of course, as you grow on and you become more senior, of course the responsibilities add on, and of course remuneration will follow as well. I hope I answered your question.
Yeah, I definitely agree with Shalini. Um, that is also the safest way to answer. But I can say that there's good progression, and but of course with progression, like what Shalini had mentioned, there's also responsibilities. And yes, not what you see is not the reality, but in my personal opinion, I feel coming from KKM, to me it's adequate.
I see. I hope that the answer for this question is to the satisfactory of the questionnaire. Thank you for the answers, Doctor. So the next question, actually we have a lot of questions. The next question will be, what is your personal criteria in achieving this role?
You want me to go first, or uh maybe you could expand the question? Personal criteria meaning, to understand the question a little better.
Or maybe I think the meaning behind this question maybe as in what is your personal goals in achieving this role, as in maybe to increase your confidence or maybe to meet certain people.
Okay.
I think that's the meaning.
I mean, there's a few ways to look at it. I think it's more of your career progression. So it's the same way. Like if you start off as a houseman, maybe in 10 years time, where would you want to see yourself? Okay, maybe say you're a surgeon, you want to be a breast endocrine surgeon, for example. Whereas for pharma, like for me, when I started off as a medical affairs manager, down the line I was always hoping to be a country medical director, which I managed to achieve in that sense. So from now, of course, I look for other roles which would it's part of career progression. So you always look for what is next. So for everybody, it's different. Maybe for Natasha, she wants to be a therapy area expert, or for example, it's different. So that is my criteria. I hope I answered the question.
Yeah.
Mm.
For me, it's I would like to one day hold a regional role. So that is my personal goal. So it really depends on what you would ultimately like to achieve. But it's for me, it's career progression as well. And I'd like to see how far, what are the challenges, because with each progression, there are different levels of challenges. So I enjoy that. I enjoy knowing how far I can go. And I don't believe we really have limitations unless we stop ourselves. So these are my motivating factors.
Mm. I see. That's a really interesting motivating factor, Doctor. And I hope that this words of motivation can also give a drive to the future doctors here. Okay, so another question. Give me a minute. Uh, if there are students interested in working in pharmaceutical company, are there any soft skills you recommend to them to learn other than medical knowledge?
Hmm. I think the number one soft skill is to be able to interact. I think that's very, very important in the corporate sector. You have to be um, a person who, I mean, we have introverts, we have extroverts, but when it comes to work, you
Yeah.
have to be willing to speak. I think that's one soft skill that you have to develop. And to be honest, I'm still trying to develop, because especially in this role, you will meet a lot of healthcare professionals, and a lot of times you'll be very busy. You know how the working world is like. So you need to have that confidence to come up to them and speak to them. Yeah, I hope that helped answer the question on soft
Yeah,
skills.
I agree too with Dr. Natasha, because if you cannot voice out your opinions, maybe you cannot grow your mind as an individual, maybe in the future.
Mhm.
Because, of course, as a future pharmaceutical doctor, you need to share opinions so that others will acknowledge your skills so that you can go far. Like doctor said, like maybe to see your capabilities, to see how far can you go.
Mm.
Mm.
Shani, would you like to
Okay.
add any other soft skills?
Um, okay, again, so I'm speaking specifically for medical affairs, yeah, because as you know, there's many areas that you can join. So it is also the level of influencing. So you need to have that skill of influencing, because you carry the science, you explain, so you need to actually get that message across. So influencing others is one, because in terms of personalities, you meet a lot of personalities. So it is how you actually manage that is also very important.
Mm. True. If you cannot tolerate people with different personalities, of course, you cannot learn a lot from them. And more, you cannot even accept criticism from different people, right, Doctor?
I mean, yes, true. But one thing, okay, so maybe I didn't put this in as well. Apart from also working in the pharmaceutical industry, they also, like what Natasha said, feedback is something which is very important that we tend to practice a lot. So feedback, we take it always on a positive note, because feedback actually is a gift. So in that sense, you will tend to learn all these extra skills as you go. I know medical school is very focused on what we learn, but these are extra
Mm.
things that you learn along the way. Even when you practice, you're going to learn, because you're going to meet all sorts of patients. You're going to have patients that scream at
Yeah.
you. You're going to have patients that love you so much. So it's that. Yes. So that's all I have to add.
Okay, I hope that answers the question. Thank you, doctors. And another question, were there any objections from people around you when you decided to pursue a career in a pharmaceutical company instead as a doctor in a hospital? If so, how did you convince them that this is something you want to do? Oh, this is quite a long question.
Yeah, maybe I could take that. So my pathway was a bit difficult. I had everyone objecting my decision to leave. But I think what helped me was I did get support from some of my friends and my husband to, to do what you really want to do. And I think at that point, I really was confident. I knew that clinical practice was not for me. So I relied on myself. I believed in myself, and I left. Convincing them, I felt was not something I had to do because ultimately it was my life. But what came out of my decision, I believe, has convinced them that I've made the right decision for myself. So I hope that helped to answer that question. Um, yeah.
Thank you, Dr. Natasha. What about Dr. Sharlini?
Yeah, I mean, this is actually a very interesting question. Now, when I reflect and think about it, actually, I did not get any objections in that sense because uh, I think happiness is something very important and finding the passion because
True.
for me, again, everybody's different, yeah. But for me, when I was practicing, I did enjoy the patient time, but at the same time, I also had a lot of um, unhappiness inside, which I felt I just needed to address. So I did follow my passion, and seeing me happy, I guess, is something that everybody around me accepted. So again, this is my personal story, so I'm just sharing it with everyone.
I see. Thank you, Dr. Sharlini. Okay, boleh tak scroll atas sikit? There's a recent question. I think this is inspired by Dr. Natasha's story, if I'm not mistaken. Good evening, doctor. Is it possible for a med degree graduate to dive directly into the pharmaceutical field without completing HO training under KKM?
Yeah, I'm sure this is a question for me. So I did not complete my housemanship, and I do not have my license. So I was able to land a role as an executive role. Of course, you start with an executive role in a pharmaceutical company. But I also would like to mention that it was a smaller company. It's not impossible. It is very much possible, as it was for me. But of course, the efforts, you need to put in a lot of effort for it. Ultimately, what they want to see is, from my understanding, please correct me if I'm wrong, Shalini, more than your license or maybe your clinical experience. What matters to them is your attitude, the willingness to learn, the willingness to put in your all in whatever role you're interested in.
I see. Thank you, doctor. I hope that that answers the question. I think someone raised their hand. Amir Haziq. Hello, Amir.
Hello. So, is it okay if I ask my own question first?
Yeah, sure.
To the doctors. So I have a question for the both of you. Were you lost in trying to find what fits you in the industry, or were you able to just know exactly what you want since you got your medical degree? Because in my opinion, when I first dived into med school, like I'm pretty sure we all agree that we've all only been exposed to the conventional, like specialties, like for example, like surgery, orthopedic, anesthesia. So like, how were you both able to finally be able to truly come to the realization that that you're doing what you want to do? I think as what have been said by Dr. Natasha before. Like, how do you truly like because like how do you drift away from the conventional pathway of doctors, and it's totally fine, but like what made you like truly were able to find pharmaceutical, I think, be in the pharmaceutical industry?
Okay. Shani, would you like to?
Is that clear? I'm so sorry.
Yeah, no, sorry, you were just breaking up, but let me just repeat your question if I got it right. How did I manage to get it? I mean, like, how did I select pharma? Was I um in terms of a path outside of medicine, right? So that was your question, right?
Yeah,
Yeah.
that could be, yeah, you could say that.
Yeah, sorry, I couldn't hear you quite clearly. I think my internet connection's a little bad.
No, it's
Okay,
okay.
very, very simple for me. Um, uh, I did enjoy the whole clinical part of it, but I didn't have that happiness. I don't know. I mean, getting up in the morning, it was like a little bit of a I wouldn't say that it just didn't make me happy. So I was wondering what else is there different? Is there something else that I can contribute to that would make me happy and also ultimately help patients in a different way? So that's why I chose pharma. And to be very honest, because I got into this field some time ago, today there's actually a lot of avenues and a lot of information that you can actually get in terms of what you can do apart from medicine. It might be the perfect choice for people. A lot of my best friends are consultants now, they're professors, and they're all very passionate about what they do. So ultimately, you need to find what your passion is. So always do your research, because there are lots and lots of information available there. In terms of the question, which I just like to also address, and I would like to share my experience here, Natasha, if you don't mind, I'll just share this. In terms of after medical school, can you get into pharma? And what do you need? So, and what she said is very true, is the passion and the right attitude. So just to share with you, I found that in Natasha, because I was a hiring manager at one point, and she had a lot of passion and she knew what she wanted, and she shared that with me, and she had the right attitude. So, and you can see she has also grown in her career. So there's no you need to have this, you need to have this. It's just the right attitude and the passion and the love for science. So yeah.
True. Thank you, Ami, for the question, and thank you, doctors, for the answer. I hope that answers your question, Ami.
Yeah, do you have any follow-up questions to that? Maybe Natasha, you can add on to that as well.
For me, I think what I understood from your question was, were you ever lost? So I heard that first part. Yes, I was. I was lost because I knew I didn't want to practice as a doctor, but what was I going to do at that time? It was blank. I had no directions, and no one around me were in any other fields besides a clinical doctor. But like what Shani had mentioned as well, it was just research. A lot of it was finding out about what was out there. And in fact, now there's a lot of modes or platforms that share this with everyone, what is available for those with a medical degree. And another important thing was trying to connect with other people. Because as much as you read it, you read a job description, it's not the same as what someone would explain to you the experience was, or how it's really like. So that's another thing that helped me. And I did look into other fields as well, but pharma was the one that enticed me the most and was most suited to my personality and what I wanted to do. Yeah. Thank you. And thank you, Shalini, for your kind words.
Yeah, in the end, it's just how much you enjoy your job, right, doctor? It's not about the, what is it called, working requirements or the job requirements that makes you feel like you feel fitted in the program or in the job, right, doctor? It's just about how much you feel motivated and how much you feel happy in doing that job.
I guess you must always be happy. In order to perform, you always have to be happy. Follow your passion. I mean, that's what I always believe.
Yeah, and that will also be a take-home message for these medical students if they ever feel demotivated. Just remember your goals, or maybe your true goals in the future, so that you don't feel like you want to give up at the moment. I think
And
that's very common, right?
yeah, I mean, of course, med school is the toughest. It's always the toughest. So you are doing your best. Just do it the best that you can. You always have ups. You always have downs. At times, you just want to give up. But that is a part we all go, and you actually learn lessons from that as you grow. And this is like an old lady speaking here, so I'm just telling you my experience. So take it all as something positive. Because the day when you feel so frustrated and you get up from it, it's a lesson that you learn, and you will always remember that. I always remember times where I felt like I can't do it, but with the support and seeing, okay, this is something that I have to do. It's a lesson learned for me. Sorry, I'm talking too much. Yeah, I'll just keep quiet.
Yeah. It's okay, doctor. It makes things much more enjoyable actually.
We're having fun, doctor.
Yeah, so I say it's very casual, so I'm not going to go like very technical. So just ask, because I've been in your shoes a long time ago. Natasha more recently, so we can share the differences. Yeah.
Yeah. So thank you. Another question. Soalan. I think we can go to this question. Is lawsuit issues common in pharmaceutical careers? Because as we all know, lawsuit issues is very common in clinical practices. And as the society grows and the internet is much more advanced, people can just Google off, kind doctor.
Yeah. So in terms of lawsuits, it's common, I think, anywhere, everywhere you go, anything, even if you put a piece of stone outside your house and someone kicks it, it's also a lawsuit. So it can happen anywhere. But one thing is, each pharmaceutical company, we also have our own legal team that look into it. So of course, everything, if there is a lawsuit, it of course has to have some merit. You cannot just simply. So we will have a very strong legal team as well. So that's another team that we have. We have legal, we have compliance. So it's a whole new world out there. So
Mm.
just sharing that with you.
Okay. Dr. Natasha, do you have anything to add?
No, Shalini is the best person to speak about that. I'm still learning from her perspective. Oh, and another thing was, when I mentioned earlier, I was blessed with a good team and a good manager. Shalini did mention that she was my hiring manager at one point. So to be very honest, the working environment also contributes a lot. So I had a very good working environment because of them. So and she motivated me, and like she mentioned, every time there will be ups and downs, and you just have to keep yourself up and keep going and focus on your goal. Sorry, I went a bit off topic there.
Yes.
I see. Hello, can anyone hear me? You were breaking out. Or maybe I think it's my internet. Again. Hello?
We can hear you.
Oh, okay. Cool. All right. I think someone raised their hand. Adam Ali, you may speak.
Hi, doctor. I have another question. To get into the position in the farm industry, was it high in competition? Okay.
Is it because it involves not only the medical students yang baru graduate, but also it involves the pharmaceutical students, doctor?
My experience, yes, it was very competitive because, as you know, at the recent days, a lot of our medical friends are leaving KKM. So in that sense, it has become more competitive. And yes, as you mentioned, it's not only medicine, even pharmacists also come into this role. So my experience, yes, that was the case.
I see. So I think this is also a reminder for the students here. If you have any interest in the pharmaceutical industry, you have to step up your game from now on. I'm sure of it.
I don't think it's only for pharmaceutical. It's just for anything that you want to do,
Mhm.
right? So
Yeah. Soft skills. Oh, another one. Do we get to involve in lab working environments? I think it depends on the scope. I think it depends on the uh working environment, right, doctor? Because I think you mentioned that there are some sectors, maybe managing sectors and clinical sectors. I think this specifies at the clinical sector. Am I right, doctor?
okay. So this question maybe is a little vague. So if you mean in terms of research and development, you get involved. So medical medical affairs, because we are part in Malaysia, not so much. If you are keen on it, then there are larger departments on research and development, which are more towards located in the bigger centers. So in that sense, if you want to work in research and development, there's always an opportunity as well.
Okay, I hope that answers the question. Oh, another interesting question. What is it like being a woman in this profession? Were there any unanticipated obstacles that had to be overcome?
Uh, that is actually a very interesting question. Just to share with you in terms of like Pfizer, our leadership team, majority consists of actually women. So I think in that sense, in terms of gender equality, is something that is also very important that they look into. So inclusion, diversity is very, very important when you look into all these pharma companies, which are multinational. So these are key things which they all work on, as well as your mental well-being is important. So that's why they advocate for good work-life balance. So all these things are actually looked into. So no obstacles, nothing at all that I've experienced.
Yeah, they also have speak up sessions where you can come front, come out and speak about anything that you're unhappy with and things like that. And they take it seriously. So yeah, like Sharlini mentioned, in that sense, no obstacles.
Mm. Oh, what is your one beautiful memory you would like to share with us during your journey to become a pharmaceutical doctor?
What's the one beautiful memory you share with us during your journey? Okay, so there's a few ways I can answer this question. Most beautiful memory you like to share with us? Because I've been in a few different MNCs. My beautiful memory is, of course, the learnings I've gotten and the different people that I've met, because you meet all sorts of different people from different departments, different countries, and they have all different mindsets that you learn a lot from. So that's one thing that's a beautiful memory for me, because for each of it, I learned something from it.
Mm.
Yeah, I'm
What
sorry,
about
Shan, I have
Dr.
to steal that
Natashyia?
from you as well, because it's the same for you. It's all the different people you meet. Not necessarily just those in your country, from other countries, regions. So that those have been very good memories, as well as the people I meet here in my environment as well. The team I've worked with, I think they have made me have beautiful memories.
So it's
Oh.
all very emotional questions.
Yeah.
It's like
It's a bit, since it's almost nighttime, man. I think maybe
yeah,
later
it's
to
a
ask a bit
Saturday night. Yeah.
touchy.
And we're going to have
Hmm.
exams soon, doctors. We're going to rethink.
Oh,
Yeah. Oh yeah, me too.
Oh, good
I
luck.
also forget.
We need motivation, doctors.
no, just do your best. And your best is the best thing you can do.
Mhm. Another question. If you maybe see yourself a few years back, maybe when you're a medical student, maybe what would your advice towards your younger self be?
Hmm.
That I know that's a really long throwback.
That's for me lah. Long throwback. What would I have told my younger self is what I would tell myself now also, which is follow your passion. Do what you are best at, and not what other people tell you that you should be doing.
Words of wisdom. Those are
Mm,
those
yeah.
are really good. Yes. Um, See, I really like talking to Sharlini because she always says these things and then you just feel so motivated and positive and yeah.
I feel like I'm more motivated to study after this. Hopefully not going back to sleep.
Yeah, it's good. Always do your best in whatever that you have, and then it's because you don't want to turn back one day and say, "Oh, I should have done this." Always do the best because you cannot question yourself one day and say, "Oh, I didn't do my best." But I did do my best, and this is where I am. So
Yeah.
this is like all the gendala already from the main topic of the
Betul, betul.
physician.
I think for me it would be not to not be afraid, because it can be very scary to try something new, to try something that maybe many people don't support you in, but to believe in yourself, understand yourself first, and don't be afraid.
Yeah.
Yeah.
Thank you, Doctor, for the words of encouragement. Alisha angkat tangan. Turun tangan. Buka mic.
Okay, we have this problem with doubts. How do we overcome doubts? Like, we thought that we did our best, but then there's this silence, a small whisper that says that, or you're actually not doing your best. So how do you overcome that?
Natasha, you want to go first?
Okay. To be very honest with you, till date, I still have self-doubt.
Yes.
That is something I'm still working on, and I'm not sure if I'll ever overcome that, right? There's two ways I look at it. Yes, there's the negative about it, because you may not have the confidence to do the things that you want to do, or to really believe that you have the capability to do these things. But a positive thing about it is also that when you have these self-doubts, it makes you someone who you would never think that you're the best or you're perfect, right? So you always feel like there's room to learn, which to me is good. You should always feel that there's room to learn, even when you're 60 and retired, because you're always learning. So I think self-doubt is something that you need to tell yourself is more of your mind telling you things. You might be overthinking, and just be confident. Some people actually say fake it till you make it. I actually do that. Half the times I'm nervous and I have self-doubt. Like when I'm giving presentations, I am so anxious. But I'm just like, fake it till you make it. And it turns out that it doesn't go so bad, and it was just in my head. Most of the times it's like that. Even if you ask yourself all the times you've had all this self-doubt, when the thing passes, don't you just think that, oh, okay, that was just in my head. I did okay. So yeah, that's my sharing.
Yeah, this has become more and more of a motivational place now. I hope that by the end of the day, the participants are feeling much more motivated to study and to pursue their dreams too. Did someone open your mic? Maybe. Oh, Makieno. Hello, Makieno. Do you want to ask anything? Because okay. He's just terbuka mic. Tak apa, saya faham. Okay, so another question. Ateh is looking for research grants or funding a part of the job scope in medical affairs. If so, is it hard to look for funds?
Okay. So if I get the question correctly, is whether the role of medical is actually to look for funding. So no, we don't. Usually, from a pharma company, we tend to help the healthcare professionals in terms of funding their research. We don't go out looking for funding. So that's not the scope of medical. Yeah.
I see. I hope that answers the question for the questioner.
Okay, so since you're like in a bit of this motivation talk, probably I can just help with a little bit of how where anywhere you want to go with anything to do with medical, why is it important to do your best? Because how do you apply what you learn in what we do? Because understanding the disease is very important. Understanding how the medication works is also very important. So, like going into understanding the science is very important. So we might not apply it in terms of treating, but you're applying how you understand science in actually helping bring medications early for patients or access for patients. So that is how you do it. And in terms of the self-doubt, everybody has self-doubt. If you don't have self-doubt, you'll be a perfect human being. So it's how you suppress that self-doubt is the thing that you need to address. Don't spend so much time focusing on the self-doubt, because then you're wasting time which you could have used to study and then
Yeah,
sleep. So I always tell myself, don't waste time, finish what you need to
true.
do and then sleep. So yeah, so that is something don't, because the more you have self-doubt, the more and more it's going to come. Everybody has self-doubt, always remember that. It's just how you overcome it.
True. Thank you, Doctor, for the another motivating words. It is actually quite refreshing. Hmm. Uh, and question to Dr. Natashyia. Do you plan on continue masters?
Okay, so masters is something that I may have looked into before, but what I've learned is it really depends. If your work needs you, I mean, if it would help in your career progression, then yes, why not? But at the moment, I don't really see the need for me to do masters where I'm at. But if any point in my life I decide to maybe venture or try something new, then yes, I may be open to that idea. But at the moment, no.
Okay. Thank you, Dr. Natashyia. Mm. Oh, and last question. I think this will be our last question lah. You said that your time is flexible, so you don't work office hours. Am I right?
No. So yes, there's the core working hours. So for example, where I'm working now, 9 to 5 is the core working hours. So you have to be available at that time. But what I mean to say is there's the flexibility in a sense that, say, I don't want to be stuck in a jam for 2 hours. I can always speak to my manager regarding that. I can start work a little earlier, or maybe I can end work a little earlier. That's what I mean by, flexible hours. But of course, the core working hours, you have to be available because that is when anyone could reach you at any time.
True.
Yeah, and I think what I also tried to, I mean, I doesn't fall under flexible hours, but also the fact that you may also need to work after hours. It really depends on the deadlines, and sometimes you need to take meetings with regional or global departments. So there's also that, you don't only work the core hours, you may need to take meetings at night as well.
Mm. So overall, it doesn't mean that you can work less, but it's just that it means that you can compensate the hours just in case if there's anything inconvenient, right?
Yeah, something like that. Yeah, maybe Shalini can explain it better.
Because each company, everybody has different policies. It doesn't
Yeah.
only mean pharma, it can be anywhere. Even if you look at KKM, for example, working as a I'm not sure how it is now, but when I was a houseman, if you work you have to work 24 hours and then you do the next 12 hours until you finish the day. So I mean, everybody has their own set rules, so it always depends on your relationship with your manager, of course, in terms of the company policies. So it's not a general rule for everybody, but of course, at times you work weekends. Like for me, this whole weekend I have events which I have to work for. So it's basically up, there are times which is very peak and there are times which are not. So it's just like any other job. So yeah,
Yeah,
doesn't
it
mean you don't
depends
have
on
to
the
work hard.
season, right, Doctor?
So yeah, different people have different times of, peak times and down times. So
Yeah. Okay, thank you, Dr. Sharlini, for the answer. I think that will wrap up our Q&A session. So thank you everyone for the questions given. I think Dr. Sharlini and Dr. Natashyia already has a role, even give some advices to us already. So I would like to thank you, Doctor, for that.
No, I think it's our pleasure. Thank you for having us. I hope I know that this discussion went around all a little bit, but I hope
All over the place.
we gave you an overview of what it's like to work in a pharmaceutical industry as a medical doctor.
Yeah. Actually, you have already given a really good overview, and I'm sure everyone already has a gist of what it feels like or what it is like to work in a pharmaceutical company while you already had a degree in MBBS. Okay, so I think that will wrap up for our Q&A session. So therefore, it concludes the end of our forum for today. And I would like to say again, thank you for Dr. Sharlini and Dr. Natashyia for giving us your time to share your experiences and also your motivating words and quotes for the students out there. I think it will actually help them to feel more motivated to continue for what was going to happen in the future, maybe a few weeks time. Yeah.
Wishing you all the best in your exams.
Good luck to
Also like to
everyone.
thank to the participants out there. Thank you, Doctor. Okay, I would like to thank the viewers out there, and I hope that you have gained something from this forum. Maybe just about what it feels like to be as a pharmaceutical doctor, and also the motivational quotes. And me as a moderator, on behalf of the committee members, I would like to say sorry if there's any mistakes or any technical errors on my side. And just a gentle reminder for the participants, before you leave, I would like for you guys to scan the QR code and put any feedback in the feedback form to list your attendance, to mark your attendance, and also maybe give some sort of feedback for us to improve in the future. And of course, we will give you time before we will take a picture. I think many people would like to leave. Maybe either want to sleep or want to eat a late dinner. I think I want to eat after this. So is it okay if we can skip to the photography session first and then we can go to feedback form later?
Boleh.
Okay. Ada orang lapar kot. Okay. All right, everyone, please open your cameras. Okay, pasang background ke apa?
Alright, buka kamera
Okay.
Okay, lagi.
Okay, we see Aiman, Amir here. Thank you for opening your cameras.
Dah tak ada nak buka. Okay, so cheers everyone. 1, 2,
Okay.
3. Okay, sekejap sekali Please try. Okay, 1,
Okay, Kakak
2,
Kampus.
1, 2, 3. Alright, thank you everyone.
Okay, thank you everyone for your active participation.
Thank you,
And also
everyone.
giving questions. And also thank you Dr. Sharlini, Dr. Natashyia again.
Thank you for having us.
Thank you,
Thank
everyone.
you.
Have a great weekend. All the best for your exams.
And rest well.
Thank you.
All right. Bye-bye.
Bye.
Don't forget to fill in the feedback form, okay guys?
Thank you, Doctor.